Good afternoon, and welcome to today's webinar, Bridging California's Multi-Tiered System of Support and Community Schools with New State and Federal Funding. Thank you for joining us during your lunch hour or between meetings. I'm Joe Bishop, Executive Director of the Center for the Transformation of Schools at UCLA and the School of Education and Information Studies. And Tyrone Howard is our Faculty Director. And we're going to spend some time together today. We're also joined this afternoon by an esteemed panel, including Dr. Hayan Kimner, Senior Policy and Research Fellow with PACE at Stanford, and also with the Community Schools Learning Exchange, Michael Lombard with the Placer County Office of Education, and Mike is Executive Director of Prevention Support and Services with Placer County, Kristen Nelson, and Kristen is with Sonoma, sorry, forgive me, that was a joke, unintended, with Napa Valley Unified School District, and she's the Wellness Programs Coordinator. And last but not least, today you're going to hear from Mr. Haro. Luis Haro is Principal at Duarte High School and Director of Secondary Compliance for Duarte Unified School District. And today's conversation, just to give you a sense of how we're organizing the conversation, and here's the bullet points so you can see it more explicitly. But we're going to talk about the policy landscape and how we're promoting community schools as part of California's multi-tiered system of support. And we're also going to talk about available funds at the state and federal level. And then we're also going to talk about the California MTSS Framework specifically. And then Dr. Kimner is going to discuss how we can think about bridging these worlds of California of California MTSS and community schools as really complementary efforts. And then we're going to hear from leaders, like I mentioned, Mr. Lombardo, Ms. Nelson, and Mr. Haro, to think about how to implement school change, ultimately models that optimize student learning front and center and focus on students that historically have been marginalized in school settings and been most impacted by the pandemic. And when you look at this map here that my colleague Geneva Sum created, our communications director, thank you, Geneva, for pulling together today's webinar, you get a visual representation of where our practitioners are based, from Placer and Napa down to Duarte in LA County. Let's go to the next slide, please. Okay, so the COVID context in which we're living in right now. New data shows that over 70,000 people have died in California from COVID over the last 17 months, 70,000 people. And likely someone you know who has passed away from COVID or been profoundly impacted by the virus. Students and staff have not escaped the reach of COVID, which has also resulted in record job losses in California, social isolation for families and young people, and coupled with racial reckoning after the murders of George Floyd, Breonna Taylor, and Ahmaud Arbery, and anti-Asian hate crimes on the rise tied to COVID. It's clear now more than ever that community schools as part of a system of support are necessary in all communities across the country. Next slide, please. So the federal government has responded to the pandemic with a historic one-time investment in California schools as part of a $1.4 trillion package, including, as you can see in the third bullet here, $15 billion as part of the American Rescue Plan. And we're still waiting to hear from Congress on this, but potentially $443 million to scale up community schools across the country. Next slide, please. And then at the state level, and Kristen, Ms. Nelson is going to talk a little bit more about this, but California has doubled down on community schools as a way to support the whole child and families, and to address inequality in communities and in schools. So as we think about eligibility for funds through 2028, the state of California is expanding the California Community Schools Partnership Program, and they are prioritizing districts who are in the greatest need as part of that program, which is still being rolled out right now, frankly, as we speak. And this is an incredible opportunity. I also want to mention and we're going to send this as a follow-up email. There are new funds for California MTSS being made available up to 50 million, of which 30 million is going directly back out to school districts and county offices of education and schools. And these are just examples of, again, federal and state dollars. And this is a unique, not only an opportunity, but honestly, a chance that people have been asking for years, for decades. And we have to make the most of this opportunity, which is why we wanted to convene today's webinar with our colleagues here today. Next slide, please. So as we think about the California MTSS framework, so really to boil down a multi-tiered system of support, MTSS as a framework represents the essential ingredients school systems need in order to focus on creating optimal conditions for student learning in exactly the type of environment that COVID has accelerated, frankly. Learning is an academic, social, emotional process, often impacted by student mental health and well-being. As you see in the whole child domain, this is the updated version of the MTSS framework. And then also as you dig down from the orange to the blue, we know that school leadership, integrated supports, family and community engagement, and inclusive practices and policies round out the essential domains for youth-centered, multi-tiered systems of support. And Mike and Hayan and Louise and Chris are going to spell this out and operationalize it a little bit more, but I just want to go back to the framework. Next slide, please. And this is going to be very quick. Our team at UCLA with Orange and Butte County is co-leading a state pilot involving now between this slide, which is 14 schools, second slide, which is 21, and then the third, which is 22. 57 school sites are all working with us collectively to address discipline disparities apparent by race across the state and the over-identification of students for special education services. So I just want to point this out, and the fact that over 600 districts are implementing MTSS in all 58 county offices in different ways, but there's a whole movement towards a system of support for the state of California, which is incredibly exciting. But I think our challenge today is, again, how do we operationalize and implement these big ideas ultimately to support youth-centered systems? Next slide, please. And I want to hand it over to my colleague, Dr. Hayan Kimner, who's going to talk about more specifically community schools and how these efforts and concepts integrate.
Oh, you're on mute, Hayan.
Thanks. Zoom 101. Thank you all for having me. It's really great to be here. As Joe said, I'm the managing director for the California Community Schools Learning Exchange, as well as a fellow with PACE. And although this consortium of organizations and people working to strengthen community schools in California is new, the work of community schools implementation in California certainly is not. And I've spent almost all of my career working in community schools doing implementation, whether it's been from the nonprofit partner side, from the research and evaluation side, from district and school implementation and policy and advocacy. So I'm really excited to be here to do some level setting and to be doing some collective thinking, certainly with my panelists and as well as with all of you that are here. To really understand how the investments that we have made in MTSS in California can support and strengthen a community school strategy. So I want to start with, some of you know Slido because we've had 2 years of pandemic learning. And I invite you all to go to a different tab, go to slido.com and put in the number 751615. And I want to know, of the folks that are in our virtual room, I think we have 112 of you, how much do you know about community schools? And I'll give you a couple of seconds to just see who is in the room. And if you're fancy with your phones, you can also use that QR code. Great, we've got a bunch of we have a few experts that if this were a real conference room, I would be very excited and I'd be pointing. but it looks like we've got folks that are here to learn or think they know, but are not entirely sure. Okay, great. And now, from those of you that are both here to learn, think they know, and are experts, what makes a community school a community school? Just type in a couple of words that you think are sort of the defining characteristics of a community school. Okay. Yep. Great. If folks can see this, a lot of word around partnerships, support for families, need, collaboration, flexible. Partnerships is obviously our huge word here. Support, family-centered, embedded. Awesome. Couple more seconds. Whole child learning really popping out. Awesome. Collaboration, MTSS aligned, locally defined, strong sense of connectedness. Great. Thank you all. I think if you continue to populate that, maybe it will keep on going, but that is something that we'll definitely look at. When we're talking about a community school strategy, it really is about this way of thinking about not bringing services and supports together to fix a child, dealing with all of their barriers to learning, which is sort of what I like to call community school 1.0. But rather thinking about community schools as a school transformation strategy. The unit of change is the school, and it's how do we organize the school and the relationships is one of our words, and resources that are part of that community to support student outcomes and their learning. And a community school is embedded in everything that we have come to know, that we've also known for a long time, that the research supports around the science of learning and development. So really important to think about this as being relationship-centered and not just a collection of co-located or wraparound programs and support services. So when we think about MTSS, MTSS is, and many of you know this already, an organizing framework. And it's an organizing framework to essentially understand who's in front of you. How do we know who our students are? How do we understand where they're coming from, what they're great at, what really makes them curious, and what they're struggling with in order for us to be able to understand who they are, identify who might need additional support, and intervene quickly. This is about screening students and organizing tiered interventions based on need and intensity. So when we think about this synergy between community schools and MTSS, I go to these sort of 4 components that I wrote about in a brief in July of 2020 with PACE, just as we were really in the throes of the pandemic and really looking at the reactions of schools and school systems, and particularly community schools, and how not just community schools responded in this way, but schools that were being effective in meeting the needs of their young people were behaving in this way, and really looking at the centrality of relationships as well as the need for student supports and really being able to go outside of the box. This was not just about the component programs. Sure, there were some schools that really mobilized around food bank. Our nutrition staff really stepped up and really thought big picture about what are the needs of children and their families. But this really was about how are we dealing with this new set of conditions that certainly are not normal, but are the reality that we have to deal with. So when we're thinking about MTSS, the MTSS work is really focused sort of on this right set of domains in this chart and really thinking about integrated teacher and student supports. How are we being proactive and responsive? And how are we making sure that this is student-centered and student-centered in terms of learning? And there's a lot of, the evolution of this work and how it shows up both in schools and districts. Oftentimes it shows up sort of in the student support side, but really trying to focus and build up and integrate conversations around learning. Community schools work is really about making sure that those pieces on the right side of the chart are grounded in relationships. And these relationships are not only with families and students, but also as in being in relationship with school partners and school educators and leaders in that way. And that not only do the relationships matter, but collaborative leadership matters, the ways in which that we show up. So Seneca Family of Agencies in their book, Unconditional Education, talk about this idea of mattering, right? And all of the folks that are part of a community school recognize that there are two statements that they feel that they can make. One is what I do is valued. And the second is I am able to be effective. And that is whether it is you are a student, you are a parent, you are a teacher, you are a community partner, you are valued and you're able to be effective. So this is where the productive synergy sits. MTSS certainly providing that organizing framework to organize the work, not only of school practitioners, but partners, but also to focus on learning as our North Star. And secondly, how do you take that organizational framework and those sets of conversations and protocols to be about building and sustaining trust? How are we investing in our student and family relationships to support the transformation, which is a lot harder than just service provision? They are you need that trust in order to make that services provision to actually be useful. And then third part of the productive synergy is about learning and implementation guidance. I said in initially that we've been doing community schools work in small pockets in California for years, and there is a lot to be learned from those early adopter initiatives. In addition, there's so many folks that have been really trying on and evolving and doing improvement protocols around MTSS. What is the type of implementation guidance that we can learn? So as Joan mentioned, there's $3 billion, nearly $3 billion in the California Community Schools Grant Program. And, there are so many components and, chief business officials across the state are kind of freaking out because they have the ESSER money, they've got all of the prospect of funding going out. You have community partners who see all of this and say, yes, this is finally our time. But the question is, what are we going to do with this? Community school strategies are not just about a $3 billion grant. As Joe said, the $50 million for MTSS is part of how we can really think about strengthening this work. And what I would ask you all to do is really think about what are the ways in which we are not just continuing to fall into our traditional silos in the way we do our work, but really understand both the MTSS conversation and community schools conversation as an invitation for deepening and expanding the work. With that, I'm going to pass it over to my colleague, Mike Lombardo, in a second, who can talk more about how that work has been evolving for Placer.
Thank you so much, Anne. And I think, Geneva, you have the run of the slides now? Yes?
Yes, I do. Yes.
Okay, well, we can move on forward then. A couple of slides to this one. So as Haynes said, my name is Mike Lombard. I'm with Placer County Office of Education. We support foster, homeless youth services, mental health, school climate, really all things school wellness. I'm going to talk to you today about a project we have to integrate mental health into schools. But I wanted to give you my contact information as well as the contact information of the two program coordinators that I'm going to talk about in a few minutes. So you can move forward. Okay, so on the slide you see here, a lot of logos and some dates. I wanted to talk a little bit about our timeline that we've had in place for implementation and who the partners are. Our project to embed wellness centers or community schools into Placer County school sites started through Senate Bill 82, which was Mental Health Services Act funding, or MHSA funding, that was directed at 8 counties across the state. A big part of this goal, and you'll hear me talk about it more, is the integration of mental health services. So county behavioral health, community providers, as well as county office of ed and school districts. So on this slide, you see all those players: the county, Placer County Office of Ed, Roseville School District, Roseville City School District were our first cohort in 2019. And those were funded through Mental Health Services Act dollars. Then in 2020, we added a project. So Auburn Union School District was added under some new funding through the state called the Mental Health Student Services Act. Very important to remember that, because all of you across the state, every county in the state now will receive this funding to integrate mental health services into schools. Every county has been offered this funding. They're in various stages of implementation. So on top of the community schools funding that Hayan was talking about, there's more funding to do this work on the way. And we have a strong partnership with the state and the Mental Health Commission, as well as our local campaign for community wellness, the little butterfly in the middle. That's a stakeholder group in Placer County that's involved in all of our decisions. And I mean stakeholders as public agencies, private agencies, nonprofit, families, consumers, or former clients, or current clients are all part of the stakeholder group that guide all the work in the county. Now, a late addition, I'm very excited back. You see Colfax Elementary School was just added. Colfax was added because of the work that we've been doing in the other school districts. A local healthcare agency literally called us and said, would you apply for a grant, because we want to fund more work on mental health in schools. I can't say who that is yet because it's not finalized, but they offered us $500,000 to fund and start a new wellness center in Colfax over 3 years. So there's a significant number of dollars on the table at the state level, federal level, also local level. But the importance of this slide really is that quote at the top by Helen Keller: we can do so little, alone we can do so little, but together we can do so much. And I think this work, and you'll hear from Kristen in a few minutes, it really is about collaboration and integration. So you can move on, Geneva. So a little bit about our program of integrated school wellness. And like Hayan said, you know, community schools is about the whole school. So you'll hear us interchange, talk about wellness centers, but it's really about a wellness campus for Placer County. We don't want a place that's exclusionary, but rather change in both adults and students' mindset, knowledge of mental health services and community-based services, and really how we approach the work we do. We have some principles, the 4 A's: accessibility, availability, affordability, and acceptability. We want those to really be at the center of our project in Placer County for families and youth. And we have a particular interest here in rural communities. You know, parts of Placer, if you're familiar with it, are a little suburban, but we have a lot of rural schools in our county. So we have a focus on that and improving the learning environments for children academically, behaviorally, and social emotionally through these centers. You can move on, Geneva. So, you know, why do we do this work? Because we know, and there's a mountain of research. I'm highlighting one source from Mental Health Colorado, but we know integrated wellness into schools increases the supports and access for students in their ecology, in their environment. So it's very important for the state to deepen our collaborations. A lot of us on this call, and I recognize some names, are parts of collaborations, but it's way up here at the county level and doesn't necessarily always get into the school sites. So we want to integrate supports right into school sites. That leads to better academic outcomes, better mental health outcomes, promotes graduation rates, decreases suspensions, and keep your eye on that, reduces absenteeism. Because as all of you move forward in these funding strategies that are really wholly one-time funded, we want to keep a very close eye on, have you moved the attendance needle? Because when you go back to the school district to make an argument for sustainability, you should be included your increased academic outcomes, graduation rates, as well as absenteeism, decrease in absenteeism, because it's going to be up to school districts to fund this in 4 or 5 years from now. So wellness center, go back just a little bit.
Sorry, one sec.
It's okay.
Way forward. Okay.
Oh,
I don't know what happened there. Okay. Let's go back.
I thought that was my one
Okay.
more.
No.
One more forward. So I'll speed it up. I think that was my cue. You'll hear more about this from Kristen, because quite honestly, we sort of stole Napa's model. She was a great partner in helping us set up our project and has been at this much longer. But wellness centers are friendly, accessible places on campus. I like to think of it as the hub of supports of services. So it doesn't just lie in that place or that room, but it's the hub that reduces stigma, access to mental health across the campus. You can go to the next slide, Geneva. Our guiding principles in Placer and kind of our work plan included wellness, respect, and shared decision making. I'll focus on shared decision making. And that sounds a lot easier than it actually is to do. We took LCSWs, licensed clinical social workers, MFTs, and paraprofessionals, families, youth partners, put them into a school ecology that's pretty set. And you might hear this from Lewis in a little bit. They don't always speak the same languages. And sometimes, navigating through that and building a shared understanding in that team, it does take a little while to do. So our focus to help support that in year one of any project we launch is about relationships, understanding each other's roles, understanding what does a MFT do, and what are the roles of school staff and school counselors, things like that. And then really focusing on equity our second year. You can go on, Geneva. No presentation would be complete without a multi-tiered model, and that's what this is all about, a multi-tiered system of support. And to be quite honest, you really, and I don't think I'll get in trouble for saying this, but you should not enter into this work without thinking about it in a multi-tiered way. What are we doing for all students across our campus, or let's expand that to our community? What are the tier 2 interventions, small group, classroom interventions that we can make? Things like wellness referrals or referrals to community-based agencies. And then in tier 3, what is the individualized case management, therapeutic services, parent consultation, things like that, more intensive services, wrap around, renew. You could functional family therapy, list off all the many evidence-based practices that are deployed. What I would strongly encourage people to do is honestly focus on that left side first, the tier 1 and tier 2 services, because if you don't, you're going to be inundated with kids with high needs at tier 3, when a lot of that could have been corrected or supported at lower levels and less costly levels of intervention. So move on, Geneva. In our program, this is probably my next most important slide. This is how we're organized. We have a program coordinator from Placer County Office of Ed, actually 2 now. You saw Ellie Murphy on the opening slide, but we also have clinical supervisors. While Ellie is a licensed clinical practitioner, we have clinical supervisors from our Health and Human Services department. So they work for behavioral health or Health and Human Services. In Placer County, we call it Children's System of Care. And their supervisor are highly involved in this project, in all parts of this project. So a person from behavioral health providing clinical supervision to a Placer County Office of Ed, MFT, who's working in a school district in a different school. So you can see the levels of collaboration, and we think that's very important because you have additional child welfare outcomes and things like that. And then we have now 11 mental health specialists and an equal number of family youth liaisons. It's important to note the mental health specialists are co-supervised and licensed and everything you need there. The mental health and community liaisons are such a vital part of these programs. I say paraprofessionals because our job requirement was a high school diploma and lived experience. Most of them came to us with bachelor's or master's degrees, but their role is to connect families to the community. You can go on, Geneva. A more visual description of how we're integrated into schools, and then I'll draw your attention again to the lower left corner. Our focus on county community providers and collaboration to be part of that school site milieu or that school site environment, along with our mental health and behavioral health supports. Now, in different schools, it might be different depending on what resources you have available to you. You can move on, Geneva. And then just some key features for what a wellness center or campus looks like, community schools campus. I think the most important takeaway from this is please focus on county collaborative partners. And, we're enjoying some pretty flush fiscal times right now. That's not going to last. And we're going to need to partner with counties and community-based agencies and family agencies to support this work. Okay, Geneva. Turn it over to my friend Kristen and really role model for this work for Placer County.
Oh, thank you very much, Michael. It's great to be here as well. Again, my name is Kristen Nelson. I am the coordinator for student wellness and support in Napa Valley Unified School District. And I'm just really honored to be asked to share with you sort of our wellness story and how we built those schools, specifically at our middle school, but how that then led to sort of the evolution of our entire MTSS rollout district-wide. So just to give you a little context and ground us in who we are in Napa. We consist of 3 towns. We are Napa proper, American Canyon, as well as St. Helena. So we run pretty geographically, pretty far apart. We're not nestled next to each other. 29 schools in total, about 16,500 students. So medium-sized district. 50% of our students are in free and reduced lunch. 50% of our students are Latinx. 25 different languages, and then about half of our entering kindergartners are English language learners. And as you probably guessed, we make some wine up here too. So about an hour and a half away from this bridge I'm sitting in front of right now. So to kind of give us a sense of the development of our program, our wellness programs here. It really started at the tier 1 level. And just like Michael sort of highlighted a couple minutes ago, we were really fortunate in Napa Valley Unified District to have kind of a history of a lot of support and resource being put into our PBIS infrastructure and building up that tier 1 piece for the behavioral, social, emotional side from the very beginning. And so they really looked at how to put those preventative universal services, PBIS, restorative practices, social emotional learning curriculums, really put that piece at the tier 1 level across the board, K to 12. But we were still seeing a really large need for higher and more strategic levels of support, particularly within our middle schools. Our California Healthy Kids Survey and other school climate data were showing that we had about 25% of our middle schoolers reporting depression and considering suicide. The majority of our behavior referrals were coming out of our middle schools. And so we decided what we really needed to do was organize our tier 2 and 3 supports. Oops, there we go. Our tier 2 and 3 supports in a way that made sense to address these needs. And so that was where we got our wellness program. And this is how we organized ourselves. So if you go forward next, we really had to look at sort of how we were going to internally organize ourselves. And this is where it kind of goes back to that MTSS framework. On a wellness side, we've always sort of leaned into that MTSS multi-tiered system of support framework to build our programming. And so we wanted to do that similarly for our tier 2 and 3 behavior mental health supports in Napa Valley and our wellness program. And these are the 4 big components that we wanted to bring in. We really wanted to build site teams, a multidisciplinary site team at every middle school. We wanted to develop a clear and consistent referral system, both how staff and students can make referrals, but also how we review data and look at data to identify those students in need. We really wanted to create some tiered interventions and a real menu of consistent tiered interventions and inventory, not just what we have at our sites, but in our community and elsewhere to really maximize our resources and supports. And then using that site team above, we would want to make sure we're progress monitoring and making sure that our students are getting better and able to access school and be in attendance at our schools. So this, I appreciate Michael mentioning earlier, the time just needed to kind of put into these components around building site teams, especially given the multidisciplinary nature of them. We don't always, even within our school system, the reason I said it was so important to organize internally, we work in silos and we don't even speak the same language to each other. And so being able to collectively work with a team and get them coordinated in a way where we aren't all working individually in our own silos, but collectively on behalf of students is actually, that takes some time. It doesn't happen overnight. You can go ahead and go to the next slide. So one of those ways that we also were able to, again, support that data review part of the referral process was by implementing a universal screening. And again, this was a way to sort of systematically use the data around attendance, grades, and discipline to understand how our students are doing and how we can plug them into more intensified supports if they need it. But then we also did a SDQ screener, which is a self-screener. It's a strengths and difficulties questionnaire that all of our middle schoolers took, and it gave us a scaled score around their basically their total difficulty score. And this is a behavioral mental health screener with different subscales around hyperactivity, emotional problems, peer strengths. It's also looking at pro-social behaviors. So we get a really good collective score on how our students are doing emotionally so that we can integrate that into the data sources that we're using to identify what supports might be next for that student. And then, of course, as any good, community wellness minded program is, you need to look at your partnerships. As everybody's been highlighting and speaking to earlier. We obviously, as we can get more organized internally, but we really have to externally organize ourselves as well and make sure that we are in alignment and in partnership with both our county office of education and all the, really amazing supportive programs they had. That I don't think were necessarily maximized and utilized to the greatest potential, but then also those community agencies, county mental health, and just really starting to speak the same language so that we can service our students in a more effective and efficient way. And these are where our now all our wellness center locations are. We have them at all 4 of the original middle schools. And we did launch one at our American Canyon High School in 2016, 2017. So we have 5 centers now operating within Napa Valley Unified School District with community partners coming in and providing on-site services, and those site-based teams, as you saw earlier, really managing and coordinating that process for service allocation. Now we kind of takes us fast forward us a few more years. We get to now. We had that thing called COVID that sort of happened in between that sort of derailed a lot of, not derailed the work, but certainly pressed the pause button. But we've now gotten back to reopening our sites, and we're here, and our board has prioritized the development of a more holistic MTSS system, and using really our wellness programming and the excuse me, the infrastructure that we really have built with wellness to kind of launch that multi-tiered system of support in order to organize not just now the behavior mental health side of the house, but also that academic side of the house, and coming together as a collective team so that we are not, again, not working in silos, but working together to figure out how to support our students the best we can. So you can go ahead and click the next 2 buttons. So just, again, to highlight, this did not happen overnight. This was really something we've been working on for quite a long time. The infrastructure that we began building for our wellness program way back in 2015 started with a federal secondary school counseling grant. We've since then leveraged MHSA and county dollars to support, some support from our from the state through California Office of Emergency Services. We've really kind of cobbled together lots of funding sources along the way. And right before COVID hit, our district was really looking at, okay, how do we combine this comprehensive system from our wellness and our academic RTI into one comprehensive system? And then, of course, we had COVID, our schools all closed down. What we did pivot quickly and try to translate all of our wellness programming onto distance learning and into a virtual context as much as possible. We put together an NVUSD wellness playbook for distance learning. That was a huge piece of at least trying to keep supports and services emotionally going for our students. And again, now we're back with this monumental shift in how we do business in schools, reopening our schools 100%, and really trying to grow that MTSS framework, which again, we do have some infrastructure for, and looking ahead, feel really hopeful about, but also really honestly, it's hard. Just want to finish a couple more points and then I'll pass it on. It is really challenging, and that MTSS framework is really has been really, I would say, critical to kind of pulling us and continuing to pull us back to that organizational framework and not getting too far out ahead of ourselves. We have a lot of layers of trauma that our students, our staff, and our whole community is showing up with. That's been challenging to address. And also, like Michael suggested, that tier 1, we don't want to lose that preventative piece, even though it feels like just so many fires surrounding us at the moment. It also is not losing sight and focus on that. So we really want to tap here in Napa, not just build out this MTSS structure, but also revisit that really strong tier 1 PBIS piece we had many, many years ago started. And then just, really looking forward again to a total resource mapping and inventorying of our schools district so that we can really grow this comprehensive system district-wide. And so that's my story. And I tried to keep it under 7 minutes. I hope I did that, but thank you for letting us share, and I'll answer any questions you might have at the end.
Thank you. Thank you, Kristen. So Hayen set the stage with really the question, how do we create a coherent system in which community schools and a system of support are the backbone of the work? And we just heard at the county level and district level, how do we integrate that system? Even Kristen just spoke about the significance of using common language and revisiting kind of old conversations about really what is our function as a system. So appreciate just you calling out the language, the significance of language, and again going back to universal supports, starting with tier 1 before we jump in anywhere into tier 2 or tier 3. So Mr. Haro from Duarte High School is going to be our anchor for today to help us think about how do we operationalize these big ideas at the school site level. And Mr. Haro's done some really fantastic work, which he's going to talk to you more about.
Hello, I'm happy to be here and share our story of how we were able to implement and kind of integrate community schools pillars and what we had as our priorities and mission and vision as our school, and to successfully implement our work here at Duarte High School. So happy to be here. This is our team. I have the luxury of having one of the best community schools specialists, Natalie Omania, and Rene Covarrubias. They've been really instrumental, obviously, in the work that we've done the last 2 years, I would say. This is our year 3 in our partnership with of community schools. And next slide, please. Yeah, so this is us in a nutshell, just our demographics there. We are kind of a relatively smaller high school in this area in the San Gabriel Valley. We have a robust early college program, which we like to talk about often, and we really focus in being the only high school in the city. We have always talked about being the hub of the community. So this community schools initiative is just perfect timing for what we were trying to do already, which was trying to be that hub for the school, for the city. And so it came in, just perfect timing. Next slide, please. So like I said, it was very timely for us, and in this area and across California, we all know with the declining enrollment, we were losing some staff members. So we were at a time where we had lost a teacher on a special assignment who was overseeing some of the MTSS work and some of the SST process. And then a year later, we had to make more cuts in teaching and other classified staff. So we lost a counselor, and then now we're down to we lost an assistant principal. So with all those cuts, it became very difficult to maintain what we had going with coordinating those services for our students. So with the addition of our community school partners, it was just perfect timing to come in and kind of clean up and kind of give that boost that we needed to get back to where we were. And for us, what we did first in the implementation, just when you implement anything new, we had to sit down and look at the priorities of our school, looking at the data. And Natalie, our community schools and specialist, took a really good approach to it. She came in knowing all the dashboard data, all the data she can get her hands on to get a good idea of what were the priorities that she felt the school needed, as far as their pillars and their priorities are, and then trying to see what we can do at our school site. So when we first met, we spent a lot of time looking at data, trying to align services, and not the services, but align priorities, I would say. So once we were able to communicate and sit down and kind of integrate our priorities, and so we can focus in on what the biggest priorities were, we can jump in and get to work. So that was key. I thought is we implementing anything new to our school, we did it very carefully, strategically, and that worked for us. We were to align a lot of our priorities and then integrate them into one system. Next slide, please. As far as for me, and it's different for every school and every principal, but these are one of the couple of the benefits that I see that are just really were profound for me. As a school site principal and every assistant principal, counselors, they'll tell you the same thing. We're stretched very, very, very thin. So this has helped me in my school site kind of keep what's important at the forefront. So obviously parent engagement, creating that system of supports, social, emotional, academic supports for our students should be always at the top of our forefront, and thinking about how we can do that best. So what's worked for me is, since I do get stretched so thin, having two other people who focus on that work constantly, and they're always constantly thinking about that type of work, it's inevitable. They're going to keep that in as a priority and keep me on target of what we need to do. When I'm in classrooms, I'm doing different things. Something like parent engagement strategies and our plan to do that can kind of fall to like the third, fourth, fifth thing. It's like, triaging things when everything's important, but what you do today is the most urgent thing. So with this initiative that we have, the community schools, keeping our students supports as a priority, and parent engagement, it's a continual conversation, and she and I meet constantly, so that's always a topic of conversation, and we always try to increase those things. Next slide, please. So this is how we sort of did it at Doherty High School. We integrated our MTSS model with the things that we have here on the screen. Looking at these are sort of relatively newer things that we've had on our campus. You see the second column there, like our Falcon Family Center for the Doherty High School Falcons. We have a parent center where we have a food bank and clothes and a lot of resources. So a lot of great things have come about with this partnership with the community schools. And it's been a lot of work that has been, it's reaching out to the community and then finding those resources and then having them a forum and an avenue to come on to campus and work with us. And that takes time. And that's something that we're proud of, that we've added a lot of great things to our campus in the last couple of years. The parent engagement has been great lately, and a lot of the resources that we have here, as you can see on the screen, is due to the fact of our work that we've done together. Next slide, please. So just finally, the implementation that worked for us, it's like with anything new, you want to just be careful of how you roll it out. Staff buy-in is absolutely critical. When it's something that it's obvious that there's a need, through data, it's easier to implement, obviously. But when things are going to be asked of staff, that has to be done very carefully. So we took our time and did it very carefully, where we presented a lot of data. I mean, COVID allowed us to do that pretty easy because there was such greater needs now. But just creating that buy-in, that need for more was pretty easy to do. And then when we asked our teachers to transform and do a whole new system of our SST or cost referral form system and how we're about to approach that work. When we rolled that out, it was easier to do once they saw that there was a need there and that we're going to make it easy for them to do. And then there was going to be some training behind that, and then obviously always that follow through, that they see that there's some outcomes and some quick wins. So the buy-in was critical, and for us, as we had a successful rollout, it never really became an issue over the buy-in. It was, let's get to work. Our students need this, and we got to work and we were running with it. So I've been very happy and pleased with our partnership with LACO, and we've seen some great gains in different areas. So that's all I have. Thank you, everyone, for your attention.
Thank you, Luis. And thank you to our entire panel. So we're going to open it up now with just a few minutes. A lot of your questions were answered in real time, but I do want to go back to Luis and ask specifically. So a colleague, Arnold Faggy, had asked a question. So how do we think about the role of schools in addressing racism and systemic racism? And specifically, how can community schools within a system support combat the reality that many young people are facing now and has become very, very present? And Mr. Haro, I know we talked a little bit about how you're engaging your students and talking to families, even just picking up the phone. I wonder if you could talk about how that seems like one example, but could you think of other examples of how you talk about racism at Duarte and even your system of support?
Great, no, thank you. So, a lot of the information we gather is from surveys and from a lot of we have many more parent workshops and parent meetings. So gathering the data around that is key. But a lot of it is behind the scenes. Yeah, we discuss those things in parent groups when we have a workshop related to that. But a lot of it is like staff development and training around that. Of how do we address those things? How do we address insensitive speech? I mean, of course, we know how to address hate speech, but so things around training around staff development days where we discuss those things and how do we approach those matters as a system. And a lot of it's a referral to someone in the front office, and it could be me or it can be someone else. But we have a lot of mental health providers that are ready to step in and help us with that, and also provide some training around those items. We haven't done anything school-wide specifically around that. It's more about just being a PBIS school. We talk a lot about behavior expectations and being kind and that sort of thing. We haven't had really any specific training or assemblies or school-wide initiatives to address racism specifically.
And for our county and district partners, for Kristen and Mike, anything you want to add or hey in?
I would just say the first thing that came to mind that I know we've really relied on the support of our restorative practices. We did a lot of work around restorative practices training with our staff, teachers. So, across the spectrum from the, classroom all the way up to the disciplinary administrative level, so that, in these conversations that are heated and also sticky and uncomfortable and messy, there's a focus on the relationship and how to repair and how to reflect on the harm done, and in a way that can both hold accountability as well as some sort of possible way to provide some restoration and fix. So I would just say definitely looking at our restorative practices has been very helpful with that work.
I will also say that when we're talking about dismantling systems of oppression, this isn't just about, making sure that we have enough of the right books in the library or culturally sustaining practices or instructional content. This is also peeling back a lot of layers around how racism is socialized and structured within our system. And, some of the work that folks have done with regards to SEL and culture and climate and school discipline, that work isn't just about saying, okay, you can no longer suspend folks. It's asking adults to really examine the types of implicit bias that they carry and not approaching it in a way that makes them defensive, but really allows them to discover how they have been carrying these habits of mind and thinking and understanding as part of a system. So work that happened actually in Fresno with Ayer Elementary, it was a conversation about the problem kids, the high flyers in the office. And it was really trying to really think through how is it that we are understanding the context of these high flyers, and the intervention was actually having teachers actually spend time with those students instead of sending them out. Lo and behold, 2 months later, there was a lot of reflection amongst those education practitioners saying, I actually didn't know that child. I didn't understand that child. So when we think about that organizing framework of MTSS, it's not just who's a hot mess in my classroom, who can't concentrate or sit still, but it's really how are we investing in an organized way to really understand and know who our students are, who our families are, and their communities.
So we are at time. I know we just kind of got started. That's usually how it goes with every webinar. It gets good, and then we say, okay, now we're going to wrap up. But want to in particular thank Dr. Kimner and for convening this group. And this was done at the Professional Learning Institute, a version of this conversation in July for California MTSS. And we wanted to bring it back though now, but just so appreciate what each of you shared at different levels within the system. And it sounds like Kristen and Mike are going to have a lot of visitors apparently Mr. Haro didn't get a chance to talk a whole lot about his strategy for connecting with families, but I'm sure he'd be willing to respond to your emails. Duarte's doing some really, really exciting things, and it's amazing they've just begun. And we will send follow-up materials. There's been a lot of link sharing, which is fantastic, but these are folks who can help you think about partnerships. You saw in the word map, partnerships is central and trust to everything that we're talking about. It requires a lot of behind the scenes work and conversation. So if you take away anything, focus on partnerships and relationships from this work, because that's what it boils down to. I want to wish you all a great rest of the week, and thank you for tuning in. We'll be back soon. Thank you.
Thanks so much, everyone.